Hello everybody, I'm Dr. George Byron Ferrer. I'm a plastic, reconstructive, and aesthetic surgeon. So I'm here today to discuss to you what is rhinoplasty. Rhinoplasty is a common term for nose lift. So what do we do for nose lifting? So it is best to differentiate muna ang rhinoplasty for Asians sa atin compared sa Caucasians, sa mga puti, no? Are there different? So more of ang rhinoplasty for us Asians because ang profile ng nose natin is low pertaining to the bridge, and then also we have tip natin is more of rounded or bulbous, and our ala, yung side ng nose, ang medyo wide. So those typical appearances make our rhinoplasty different from the Caucasian rhinoplasty. Ang Caucasian rhinoplasty, they are more gifted with the bridge. They have more pointed tips or projection. Now, Gore-Tex rhinoplasty uses itong implant which is Goretex. Actually, ang Gore-Tex is a brand name for yung EPTFE, which is actually expanded polytetrafluoroethylene. It is an inert material, okay, that is used bago lang siya, okay, not really bagong-bago, but compared to the other famous type of implant, which is silicone, this is relatively newer technology compared to your silicone. Both would have always its pros and cons, but right as of now, what I want to discuss with you are the pros and cons of Gore-Tex rhinoplasty. Gore-Tex rhinoplasty, it's very common that they would notice that because of the reaction of the body to the Gore-Tex, the difference is that the body envelopes it, and as well as because it is porous, yung material, tissues interact and go through the implant. That's why it is more sturdy, it is more absorbed. That's why yung end result, usually people say that is more natural. But actually, when you say natural, it will always depend on the eyes of the patient. Okay? What is natural for me can be placado or animated to some. What is natural to the patient may be placado or animated already to me. So, para sa akin, both silicone and Gore-Tex should be utilized arriving at the same aim or target na madidictate ng gusto ng patient, what the patient wants, and what the nose will allow it. Because it will always be a balance of how high the angle or how large the angle is from the bridge, how much projection the tip will allow, in reference also to how wide the ala can be trimmed or lifted. Okay? Now, ang Gore-Tex implant, okay, inert siya. So, supposedly forever na siya, just like your silicone. Compared to silicone, because of its the reaction of the body that it receives, okay, in due time, sabi nga nila parang nagiging natural, but actually it just stays the same. It's just the body absorbs it more or reacts to it better. The body adheres to it, kumakapit siya more than the silicone, because with silicone the body just envelopes it and forms a capsule, but it doesn't go through the implant. So that's one basic difference. Bakit ang silicone, when you arrive at reasons why you want to remove the silicone, is it's easier to remove because it's just a capsule that you have to open and remove the silicone and remove the capsule. Compared to your Gore-Tex, where you have to remove all the granulation tissue that has formed around it inside the implant. But rejection rate, mas mababa ang ating Gore-Tex because of its natural tissue reaction. Now, when do you want to change yung Gore-Tex? Supposedly, the only reason why you want to change your implants is if you have fallen to this, sabi natin, the unlucky ones, less than 5% who had formed rejection. So the people who would fall into the unlucky ones, less than 5% who had this form of rejection or infection, sila yung would have the reason kung bakit gusto mo mag-change ng implant. Okay? Why you want to change your implant is if nagkaroon ng displacement or asymmetry for immediately after the surgery, bigla nagkaroon ng accident or trauma. Okay? That's why we're very careful not to have all this trauma. Kaya nga, the first 2 weeks is very, very important. And then also, that's it. Now, if the patient would want a different look, that is another common reason why you want to change it. Now, syempre, changing it, if there are indications of infection or rejection, definitely you would want the nose to rest for at least 1 to 3 months. Yun yung difference. But if there are no evidence of any infection, even outright revision, pwede natin gawin. Basta walang obvious reason of injection.
Dok, yung price pala ng Gore-Tex, magkano siya usually nagre-range talaga?
Yeah, okay. So, syempre, knowing that silicone is cheaper talaga, that's another difference. Silicone is cheaper because it has been with us since 1970s pa. And a lot of people have mastered it already. And it's very much available. That's why it's cheaper. And then, Gore-Tex, since it's newer than their silicone counterpart, mas pricey siya. Okay, usual range niyan is from kung just outright, just the implant, konting revision to the alar and to the tip can range to from 70 to as high as 120, depende po sa gagawin. Because using Gore-Tex for improvement ng nasal profile, dito lang po sa bridge siya ginagamit, okay? Unlike for your silicone, it's not just the bridge that is improved, you also improve outright already the tip. Okay, and then usually when you utilize your Gore-Tex implant, you use also your ear cartilage to get a very good tip definition. So yun. So kaya usually mas mahal siya kasi nga meron siyang kasamang cartilage for your tip. And then sa revision, as I explained, mas technically harder siya than removing or revising a silicone implant. That's why mas pricey siya compared to your revision of your silicone implant.
Okay. Thank you so much, Doc George Ferrer.
Bye-bye.